I love Reese's.
Do you want to go and watch a movie?
Should we brush our teeth first?
No, you don't have to because our teeth is gonna fall out anyways.
Whoa, girls, did you guys eat all this?
No.
No? Do you know how much sugar is in this that's really bad for your teeth? Did you brush them?
No. We don't have to, or maybe they're gonna fall out anyways.
I think it's time you girls get a little education in your primary teeth. They're not baby teeth, they're primary. Come with us. Girls, what did we say your baby teeth were called?
Primary teeth.
Your primary dentition consists of your centrals, your laterals, canines, first molars, and second molars. Universal is A through J for maxillary, K through T for mandibular. For Palmer, you use brackets, and it's A through E in each quadrant.
Why do teeth fall out?
Do everybody's teeth fall out?
Primary teeth not only hold the place for permanent teeth, but they go through a process called exfoliation. This process is when the teeth shed. The roots of the primary teeth reabsorb, the teeth become loose, and then exfoliate, or fall out of the mouth.
And adults have primary teeth?
Ankylosis is the fusion of cementum of a tooth within alveolar bone. This can happen to retained deciduous primary teeth over time. This can be seen in adult patients who have congenitally missing premolars and retained deciduous molars.
Oh.
The first function of primary teeth is space maintenance. This reserves space for permanent teeth for proper alignment, spacing, and occlusion. There's two different types of spaces. Primate spaces. As the bone continues to grow, deciduous teeth develop spaces between them called primate spaces. There's also leeway spaces, which allow for extra space for eruption of permanent canines, first premolars, and second premolars. Okay. The second function is mastication, known as chewing. The third function is appearance, for proper aesthetics. The last function is muscle development and speech. The teeth support cheeks and lips, maintaining appearance and the ability to speak.
A, B, C, D, E, F, G.
Primary teeth are smaller, whiter. They have constriction at cervix, longer roots, less mineralized, less anomalies. They have thin enamel and dentin, larger pulp chambers closer to occlusal, which means they have more risk of decay. Permanent teeth are larger, yellower. They are more mineralized. They have a thick enamel and dentin, and they have smaller pulp chambers. The eruption dates for primary teeth are as follows. Mandibular centrals, 6 months. Maxillary centrals, 7 months. Mandibular laterals, 7 months. Maxillary laterals, 8 months. Mandibular first molars, 12 months. Maxillary first molars, 14 months. Mandibular canine, 16 months. Maxillary canine, 18 months. Mandibular second molar, 21 months. Maxillary second molar, 24 months. Mandibular teeth usually erupt before maxillary. Normally they erupt in pairs. Girls usually develop earlier than boys. Molar roots are flared to allow space for permanent teeth. Some general facts about primary anterior teeth are they have a prominent cervical ridge on the facial and lingual surfaces, prominent cingulum, mamelons may be present, long root length, roots bend labially and in the apical third, and a smooth labial surface. Some general facts about primary posterior teeth are prominent cervical ridge, roots are widely separated, more so on the second molar, furcations near the crown, a narrow occlusal table, shallow occlusal anatomy, very few grooves and depressions, and the primary second molars are larger than the primary first molars, which is opposite of permanent teeth. The maxillary first molar's crown does not resemble any other crownless dentition because it's a premolar-molar combination, very prominent buccocervical ridge seen from the mesial, and it's wider buccolingually than mesodistally. The mandibular first molar and mandibular second, as second is larger and resembles a mandibular first permanent molar and can be mistaken for one. The mandibular first molar is unique to itself It's rhomboidal shape. It has a distinct transverse ridge. Medial root contains longitudinal groove and 2 root canals, and a distal root is shorter than mesial root with 1 canal. The mandibular second molar resembles a mandibular first permanent molar. The central pit radiates grooves into a Y shape on the occlusal surface. The only permanent teeth found in Ange's mouth are her mandibular central incisors, her mandibular lateral incisors, her maxillary central incisors, her mandibular first molars, and her maxillary first molars. How old is Ange? Brandy, on the other hand, has all her permanent teeth except her maxillary canine, which has not yet erupted. She also does not have her wisdom teeth. How old is Brandy?
I'm 8. I'm 11.